If you're a breast cancer survivor and you've recently had a surgery, follow along with this video as I guide you through 5 exercises to start doing early on in your recovery to help you get back the strength that you need. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and a certified lymphedema therapist. Make sure that you subscribe to my channel for next week's video on progressing your strength training program after breast cancer surgery. Resistance exercise is critical to do as a breast cancer survivor, but it's important that you do it safely. You want to progressively and slowly get back into strength training after breast cancer surgery, and always check with your surgeon and your medical team first before you start any exercises. The exercises we're going through in this video can be started around 3 to 4 weeks after your surgery and after you have your drains removed and your doctor tells you that you can start strengthening. Before you start a strengthening program, you want to make sure that you have full range of motion with your shoulders and with your neck to avoid any type of injuries or pain with these exercises. If you do need to work on your mobility, especially your shoulder range of motion, then make sure you check out the links in the description below with my videos on early mobility exercises after breast cancer surgery. If you have any pain, discomfort, shortness of breath, or something just doesn't feel right while you're doing the exercises in this video, you can decrease the range that you're doing so you do it in a smaller range, cut back on the weight, cut back on the repetitions that you're doing, or you may need to stop doing the exercise. These exercises can be done in sets of 10, once or twice a day to start out with, but again, check with your surgeon first. This is level 1 of the strengthening program, and so we're going to be using very light resistance. You can either use 1 or 2 pound weights, or you could even use canned foods for your weight as well. All right, the first exercise we're going to do is bicep curls. Your biceps are the muscles at the front of your arm. And so you're going to either take your canned food or your 1 or 2 pound weights. You're going to have your arms resting by your side, palms are face up, and you're going to just slowly and controlled bring your arms up and extend your elbows. So we're going to do 10 of those. We'll go ahead and start now. You're going to bring them up 1 and down, up 2, down, 3, good. As you do these, you want slow, controlled movements. This is 5 and 6. Good, we got 4 more. This is 7 and 8, 9. Great job, we got 1 more, and 10. Excellent job. The next exercise, we're going to work on your tricep muscles. So these are the muscles in the back of the arm, opposite from the bicep. With this exercise, again, you're going to take your 1 or 2 pound weight or your canned food, and you need a sturdy surface. I would recommend a countertop. So the arm that has the watch on it, we're going to pretend is the side that we had the surgery on. So you're going to take your unaffected hand, and that's what's going to support you with this exercise. You're going to have your feet a little bit staggered. That's going to help support you. And then you're going to have your arm down by your side. You're then going to bend it to about a 90-degree angle, and you're going to kick your arm back. So you're going to extend it. You're not going to hyperextend it. And then you're going to come back. So again, you're extending back and then coming forward. So again, we'll do 10 of those. So again, get yourself nice and stable, relax the shoulder. It shouldn't be hiked up by your ear. And we're going to go ahead and kick back for 1 and 2 and 3 and 4. We want nice slow movements. We're at 5, we're halfway there. Excellent job. We've got 6 and 7 and 8 and 9, and last one, 10. Excellent job. The third exercise, we're still going to be in the same position. So you're going to have your unaffected arm that's supporting you. You're going to be slightly bent over here, still have your legs in that staggered stance to support you. But this time, instead of just moving the elbow, now we're going to be moving the whole arm. So we're going to be doing an upright row just with the arm that we had the surgery on. And so we're working on your back muscles way back here. So these are going to help get that side stronger from the surgery. So again, you're going to get yourself set up, come a little bit over. If you can, you're gonna engage your abdominals a little bit. You don't want your back sagging down. So we're engaging the abdominals, arm is hanging down, and you're going to bring the arm up with the elbow that's doing the movement. So you're going to pull up and then back down, almost like you're trying to start a lawnmower. So we'll go ahead and do 10 of those. So we're starting down at the resting position. Again, arm is relaxed and you're driving that elbow up and back down. There's 1 and 2, 3, nice slow controlled movements, 4, 5, halfway there, 6 and 7, 8, 9, and we've got 1 more, 10. Excellent job. If you had pulling at all in the breast with that, you can do just a smaller movement, and so that won't pull as much. All right, time for our last exercise. For this one, you're going to be lying down either on the floor on a yoga mat, or you can do this lying on your bed. This is called a Serratus punch. We're working on a muscle that sits at the front of your shoulder blade, and it helps to stabilize this muscle, again, help you get stronger after surgery. And with this exercise, you're going to start with your hand pointing up towards the ceiling. If you'd like to, you can start without a weight first to get the movement correct. You're keeping your elbow straight through the entire movement, and so you're punching up towards the ceiling and then relaxing back down. So your elbow stays, again, straight the whole time. Punch up towards the ceiling and then relax. Punch up and relax. So we'll go ahead and do 10 of those. Again, you can start out without doing any weight, or you can do it with just that 1 or 2 pound weight or your canned food. So we're gonna go ahead and punch up. So we're going to punch up for 1 and back down. 2, 3, you should feel your shoulder blade moving along the back of your ribs. 4, 5, 6, 7, 8, 9, and 1 more, 10. Excellent job. Excellent job with those first 5 exercises to start you, just to start to get back into some light strengthening for your upper body. As you get 4 to 6 weeks out from your surgery, that's when you can start progressing these lighter weights to a little bit heavier, but you still want to go very slow and progressive. Typically every 1 to 2 weeks, then you can increase the number of reps or the amount of weight resistance that you're using. As you continue to increase the weight and you get farther out from surgery, then you can start doing these exercises with, again, heavier weights. And instead of doing them just once or twice a day, then you can do these twice per week at 2 to 3 sets of 10 to 12 repetitions. And that can be a good long-term program to help continue with strengthening your muscles. Please give this video a thumbs up if you found it helpful with the recovery of getting you stronger after your breast cancer surgery. Make sure you subscribe to my channel for more videos on managing side effects after breast cancer treatment, and to get notified when my next video comes out on more strengthening exercises after breast cancer surgery.